Hello, my name is Tisa Fola and I work with African Center for Treatment and Rehabilitation of Torture Victims as a social work coordinator with the organization here in Uganda.
Welcome all. My name is Abubakar Barusi Juma.
Hi, my name is Ellie Free and I work for Room to Heal, which is a therapeutic organisation based in London providing support to torture survivors.
Hello, good morning, good afternoon, everybody. I want to speak some sentences about the adaptation of global standards and rehabilitation to torture victims in our center.
Hi, I'm Mariam and I'm the fundraising assistant at the Treatment and Rehabilitation Center for Victims of Torture in Palestine.
So I'm going to focus on IRCT Global Standard 12, which is around prioritising staff well-being and being aware of vicarious trauma and burnout of staff.
What is extremely important for us is paragraph 12, care for staff. Since 1996, we offer regular team supervision and individual supervision for the staff members continuously.
We all know that the Universal Declaration of Human Rights, by its Article 23, affirms that the right to work includes just and favorable conditions of work as a fundamental human right. Human capital cannot be replenished in the same way as medicines, equipment, and supplies. This act of working empathically with people and the continued exposure to torture narratives can build up over time, leading to trauma responses for our service providers.
Caring for staff means to ensure that employees struggling with poor mental health are supported appropriately, especially when they might be at risk of harming themselves or others. Well-being and mental health support at the Treatment and Rehabilitation Center are crucial to enable all staff to work effectively in their roles.
Owing to the above, we had to develop and implement programs based on safety and care for our staffs in tandem with IRCT Global Rehabilitation Standards so that our staffs can be able to offer quality, effective, and efficient services to the victims and survivors of torture.
Senior management has made it their moral obligation to ensure the psychological safety and well-being of staff, which they state is their duty of care. Safeguarding employees is a key part of supporting staff with their mental health that are at risk of suffering significant harm.
So as a therapeutic organisation, we are definitely aware of vicarious trauma and burnout of potential burnout of staff. And these are some of the ways that we try and address these concerns. First of all, we offer clinical supervision to all of our therapists on a weekly basis in small groups, and we offer non-clinical supervision to other frontline staff, including caseworkers and clinical administrator. And this is provided by senior therapist, external to Room to Heal. And I think that is absolutely essential in an organisation like ours.
We have already developed a written policy on safety, health, and working conditions for our staffs, protection in the office. We have also developed standards, guidelines, and codes of practice on occupational health and safety for all our staffs in the organization. We have assured our staffs of access to psychological support and are able to report safety concerns without fear of retaliation.
And when it comes to psychological safety, we have the human resource that has all that is needed for us to look into our care. Where we have annual leaves, we are entitled to annual leaves. We also have the prevention of sexual exploitation abuse of the staff and whom to report to when such cases happen to you.
We have open-door policies that enable all staff to speak openly and honestly about specific issues that might be bothering them. When an employee is undergoing emotional distress, management reacts in a supportive way as they are aware of the impact on well-being. We have regular stress management sessions to reduce stress and improve work efficiency.
Through providing access to mental well-being and social support services for our staff, including advice on work-life balance, risk assessment, and mitigations. We have, as an organization, what we call a self-care plan. We did resolve to come up with this plan, which is being updated regularly in the organization. It details how they will care for their physical, mental, and spiritual health, as well as how they will include new ideas in that plan so that they continue to grow personally and professionally.
And also we have the staff individual counseling. Because of the sensitive cases that we work with, staffs are then granted to seek counseling from from identified professionals to offer them the staff. And then also we have the care for caregivers, where we the staffs are also cared for by another professional person or consultants that have been sought out there, so that we feel that we are fresh or revamped enough to then get back to our work. And that is how staffs then feel they are safe and secure to work.
One of the other things we do internally is we have what's called a feelings meeting, which is a monthly meeting, and it's an opportunity for all staff, frontline and non-frontline staff, to come together to talk about any issues that are coming up for them at that moment in time. It could be personal things, it can be work-related, it could be around team dynamics. And my experience and the feedback I have from other team members is that that's really essential to ensure we're all working together. We understand where people are at that time and can support each member of staff knowing what's going on for them. So that's something that I'd highly recommend.
Our board of directors has even established a committee dedicated to caring for the well-being of staff. We are offered training to handle and prevent stress at work. This is to increase awareness of the signs of stress, to know when to interrupt behavior patterns when the stress reaction is just beginning, to learn new skills of active coping and relaxation.
Some of the areas which our staffs, which we have encouraged our staff to consider and work on, are ensuring a work-life balance with enough time to relax, recover and spend time with loved ones, even during high-pressure periods. Number 2, by engaging in stress-relieving activities for their body, mind, and spirit. And the last one, regularly sharing frustrations and achievements with peers and with the entire organization and supervisors.
Also, we have recently been on a team away day. We tried not to talk about work. We were just connecting with each other as individuals. We went to a really beautiful space in nature. And I think for us, that will be something we'll want to do more of in the future.
Thank you so much.
Thank you.
So those are a few things that we do at Room to Heal. Thank you. Bye.